Naheed, the floor is yours.
Okay. Thank you so much. Good evening from Bangladesh. And I'm presenting Friendship NGO. And my today's presentation is Integrating Climate Resilient Healthcare in Coastal Bangladesh, the experience of Friendship Hospital Shyamnagar. Thank you. Next. Yes. So, because of the Friendship NGO, where I work, and our mission is from Bangladesh, a country facing the most pressing of humanity challenges, we develop scalable solutions to strengthen marginalized communities and empower people to transform their lives and reach their full potential. Here is the map of Bangladesh, where you could see the friendship intervention areas all over Bangladesh, and the hospital where I work, and these climate resilient integrating healthcare solutions we implemented in the southwestern part of Bangladesh. Next. And the hospital, which is established in 2018, and this hospital, this climate resilient Friendship Hospital, the Shyamnagar, and has been designed to withstand the climate impacts, because these areas, you could see the hospital design in the picture, as well as the wetlands surrounding the hospitals. These areas hit several times by the strong cyclones in previous 2007, 2009, and these areas got destroyed and damaged the infrastructure and also damaged the agricultural land and livestock. So withstand these climate impacts with these hospitals established, also reduces environmental footprints and deliver quality care to vulnerable communities, because this hospital, it has established in a very remote settings. It is not that in a city, it is the sub-district areas, and so the people surroundings are very poor and they are climate impacted and already been struck by several cyclones in their lives. Next. So the main objectives are strengthen healthcare delivery for these vulnerable communities, also protect patients and staff from impact of climate change, reduces healthcare cost over time, and also improve energy efficiency and restore the ecosystem. So what are the interventions? Interventions, in the first intervention that we constructed a climate resilient infrastructure, the hospital. I will show you the hospital structures later on, and also decentralization strategy for operating the hospital. This is also very unique style that we implemented, and also addressing preventive healthcare delivery and focusing the outreach activities. And also, of course, the additional is the clean and reliable and energy source. Yes. So the impact and results. And already I said that we unique climate resilient infrastructure, the hospital, which was constructed, and also this hospital won a RIBA International Prize in 2021. RIBA is the Royal Institute of British Architects Award that we won in 2021. And because this hospital used locally made bricks and water as its chief starting point, so we harvest rainwater, and this rainwater cooling the hospital and its surrounding environment. And also spacious corridors and wards made easy cross ventilation, and which cause air for breathing and daylight passing. And also preventive healthcare sessions through an outreach program. So all these make this hospital quite unique. And through this hospital, access to quality healthcare. Already, since established in 2018, We provided services to almost 400,000 services to almost more than 200,000 patients. And also we started cervical cancer screening program in 2020 and provided screening to 2,743 women. And from last year, actually, we started mHealth program. It is mHealth apps. Through mHealth apps, we connected with our outreach program through which we provided 12,394 healthcare services. And also, we connected with specialized doctors. So through telemedicine consultations. So these few innovative approaches we started from this hospital. Next. So these are the glimpse of all the hospital activities you could see. Daily activities as well as training by the international teams, local teams, and surgeries. We do have outdoor service, indoor service, and many different observation days we celebrate. And training, also we provide training to outreach team as well, how to connect the outreach communities to this hospital as well. So this is quite a unique intervention, and we call this three-tier healthcare model, which we will discuss later. Next, please. Yes. So another impact and result is the decentralization strategy. Developing this hospital to work independently. This is also one of the objectives, to make it independent under the locally appointed head of the hospital. So, which reduces frequent monitoring visit from distance without affecting the organization mission. So, transportation reduced and the head is staying, me as well, me is the head. So, I'm staying in this hospital. So, this monitoring strongly monitored, which also motivate the staff. So, this strategy we started from last year. And another thing is that implementing procurement policy. Thank you, Sonia, that I heard lots of innovative part of procurement and supply chain, which might help me. And also we started implementing procurement policy for uninterrupted supply of medicines and consumables. Previously, we procured everything from our capitals. It is quite 300 kilometers or more than 300 kilometers from the hospital. Now we're trying to procure everything from the sub-centers, which are around 60 to 100 kilometers away from this hospital. So might reduce the carbon emissions and transportation hazards and everything. And also implementing a three-tier healthcare model. You could see on the right-hand side, yes, this is a three-tier healthcare model, where it is about filtering the patient's flow. We try to encourage patients to receive their healthcare in their communities rather than traveling. So we introduce community health workers, empower them with mHealth apps. And so it is like a filtering mechanism. First contact with those community health worker, then the second tier is the satellite clinics. We do have satellite clinics here surrounding the hospital. So patients can be cured by the paramedics, and those patients who are referred usually come to these referral centers, the first tier. These are the hospitals and also the floating hospitals, this mainline hospital and also the floating hospitals in other areas of Friendship catchment area. And these are all the activities. Also, you could see in the pictures about the sun, that all the newborn babies under the sun, so they are getting vitamin D, also sun. So these are because of the long and vast corridors we do have. And also you could see the spaciousness of the hospitals inside. Thank you. Next.
Naheed, you're already over time by 1 minute, so please move to the conclusion. Thank you.
Yes, please. Next. Yeah, so other areas like clean and reliable energy by solar and sustainable water and natural resources, we harvesting rainwater, low carbon and sustainable operations, we do transport like bikes and e-vehicles we use, and sustainable healthcare waste management. So our conclusion is, last slide please. Yes, the conclusion is decentralized, accessible and affordable healthcare for the climate impacted communities. So we highlight that importance of combining resilient infrastructure, community-based action and strong institutional leadership which can build climate resilient system. Thank you all. Thank you.
Thank you very much, Naheed.